Good afternoon, everyone. My name is Jessica Hermance, the Women's Health RN Care Coordinator and Maternity Care Coordinator at the Albany Stratton VA. In recognition of Go Red for Women, which will be celebrated on Friday, February 4th, 2022, I'd like to welcome Dr. Marisa Orgera, cardiologist at the Albany Stratton VA Medical Center, for an informative Q&A in hopes of raising awareness about heart health. Dr. Orgera, my first question is, as a woman, do I need to worry about heart disease? I thought my greatest risk was breast cancer.
Thank you, Jessica, for having me. That's an excellent question, and you bring up a common misperception among the public. We've given a lot of attention to breast cancer, which is an important diagnosis in women. In reality, though, breast cancer is not the leading cause of death. In fact, the #1 cause of death among women is heart disease, and it has been for several decades, even since I finished my education 25 plus years ago. In fact, if you were to make a comparison, in the United States alone, 1 in every 29 deaths among women is due to breast cancer. In terms of heart disease, 1 in 2.4 deaths of women is due to heart disease. So heart disease is a concern for each and every woman today.
Great, thank you for sharing that information. So is heart disease only a concern as a woman ages, or can it affect the women sooner?
Right. Traditionally, the disease of heart disease in women was much more age dependent. And by that I mean, historically, men were made up the higher prevalence of heart disease among the earlier decades of life, and women did not catch up to men until later in life, particularly at the 5th decade of life, which correlates with the onset of menopause and beyond. However, we're seeing a very concerning shift right now in that the largest, fastest growing group of women with heart disease is in fact the younger age group, going as young as 35 and up to age 54. And this has actually been attributed to the obesity epidemic that exists in our country.
Great. The information you're providing us is very enlightening and great for us to hear. It shows how heart disease affects women just as equally as it affects men. It shows the importance of focusing on ourselves, listening to our bodies, eating healthy, exercising, and the benefits of meditation and rest. What are some of the risk factors as women that we should be aware of?
So we have some very traditional risk factors, which are, prevalent both in men and women. And then we also have some novel, distinctive risk factors that are seen only in men. Just to go over some of the traditional risk factors, hypertension is a very prevalent cause of heart disease in women. In fact, it's considered the most prevalent risk factor, and it's probably associated with the longevity of women. In fact, if you look in the United States alone, 25 million women carry a diagnosis of high blood pressure. The ACC and AHA have actually lowered the guidelines defining high blood pressure as a blood pressure of greater than 130 over 80 millimeters of mercury. When women have very high blood pressure that's uncontrolled, specifically blood pressures greater than 185 millimeters systolic, their incidence of cardiac death increases 3-fold. So that is a critical risk factor to be aware of. In terms of a modifiable risk factor, I cannot stress enough the importance of tobacco cessation. There are many things that we can do that we have no control over, our family history, our genetics, our age, but tobacco is one that if we can get our patients to quit smoking, we could greatly reduce their risk of cardiovascular and cerebral vascular events. Another very common traditional risk factor is hyperlipidemia. And it's interesting to note that the lipid profile of a woman changes as a woman ages. So there are 2 types of cholesterol. We talk about the HDL, which is the good cholesterol that takes that cholesterol out of the bloodstream and puts it in the liver. and the LDL, which is the bad cholesterol that lays down plaque in the blood vessels. Traditionally, women who are younger have very high HDLs, and there are certain things we can do to improve the HDL, particularly weight-bearing exercise. Unfortunately, as a woman gets older, there's this paradigm shift where the LDL, or the bad cholesterol, gets higher, and the HDL, or the good cholesterol, gets lower. In fact, a low HDL in a woman is a very, very poor prognostic indicator, or a red flag, so to speak, in terms of a lipid profile in a female. Other risk factors, diabetes mellitus cannot be emphasized enough. There's a very high correlation of diabetes mellitus to heart disease. Unfortunately, in women, we tend to find where men will only have a single risk factor, a woman who's presenting at a younger age often has a constellation of risk factors. So she may have diabetes mellitus, she may have obesity, she may have hyperlipidemia, and she may smoke. So diabetes is one to always be aware, and to treat a patient with diabetes with the same type of medical therapy you would treat a patient who has established heart disease. I mentioned about obesity being a critical risk factor as well. However, we have some very unique, distinctive risk factors, and I think that it's useful for both primary care and such subspecialists to be aware of them, because it may prompt you to do some testing or delve into something that you otherwise wouldn't. Particularly the period of a woman's life in terms of childbearing and what their pregnancy history was. For example, gestational diabetes, which is a condition that can occur during a pregnancy, increases a woman's lifetime risk of diabetes mellitus by 7 times. Preeclampsia, which is a condition in which a pregnant woman can develop elevated blood pressure and protein in the urine, doubles the risk of ischemic heart disease, stroke, and thromboembolic disease 5 to 15 years following the pregnancy. There are some autoimmune diseases in women that have a high correlation with coronary disease, specifically lupus and rheumatoid arthritis. When a woman has onset of menopause is a critical factor. A woman that develops menopause at earlier than a traditional age has a 3 times higher incidence of coronary disease compared to a woman the same age who is still premenopausal. And then lastly, I want to bring up some of the psychosocial factors that we've learned about. Women, unfortunately, have a higher incidence of depression following a myocardial infarction. When they do develop depression, their incidence of a severe cardiac event increases 3-fold. In addition, young women who have a family history of trauma, childhood trauma specifically, have a higher incidence of heart disease at an earlier age in life. So there's a lot to consider when we think about risk factors for women with heart disease.
Yeah, there's a lot there to consider. So one of my other questions is, for women, they say the majority of cardiac events are silent killers. Are there any indicating symptoms prior to an event that we should be aware of?
That's a great question, because it has been shown far and away that women are underdiagnosed when it comes to heart disease, and whether that is a communication factor in terms of describing their symptoms, or a different mindset of the clinician who is evaluating the patient, or perhaps a little bit of both, is hard to say. I don't actually think it's so much that it's a silent killer. I think that the traditional symptom of the elephant on the chest may not be what the woman presents with. So, for example, nausea or dizziness or interscapular pain in the back of their neck, even fatigue, believe it or not. These are some very not clear cut, but should prompt I think more delving. I literally had a patient of mine who only talked about being nauseated when she walked, and that was it. She wasn't complaining of chest pain, but she had very significant heart disease. So I think that traditional symptoms can occur, but we need to be aware of these other symptoms, particularly in women, when we interview them.
Okay.
And take a history.
All right. Is there anything that I can do as a patient to reduce my risk of heart disease?
Absolutely. So, you know, number one, if you smoke, please quit. Excuse me. Number two, you know, certainly modifying your blood pressure with adherence to a medication that you can take consistently and tolerate is critical. Treating your cholesterol and trying to get to goal and trying to work on your diet. With respect to exercise, the AHA actually recommends 30 minutes a week. 30 minutes a day, I meant to say, of daily exercise, up to 60 to 90 minutes if you're trying to lose weight. We know that there are much greater barriers in terms of exercise for women who often have caregiving responsibilities. And certainly having a partner or somebody that you can be accountable to, such as we do with the MOVE program here at the VA, can really make a difference in terms of your success.
Great. All right, Dr. Orgera. Well, thank you very much for taking the time to speak with us today. I feel it was very informative, and it will be a great for all the women to be able to hear. Is there anything else that you feel we should know?
I think that heart disease in a woman is so meaningful and so critical, and it's not just for you, but it's for your loved ones as well. So I think if you get a diagnosis of heart disease as a female, please share that information with your sister, with your daughter. You could be making a difference not only in your own health, but in the health of those you love. So we appreciate you and giving us this chance to share this information. We actually know that at the VA, women represent the fastest growing sector of the VA population, and we want to do everything we can to include them in the care that they deserve.
Thank you very much. So I guess this will wrap up our session, but for anybody that has any questions regarding today's question and answer, if they want to reach out to the Women's Health Clinic, we can field those calls at 518-626-6140, and we'll be happy to get you the answers that you're seeking.